Welcome back to TV5 News at 9. It's time now for Aging in Style with McLaren. And joining us now is Stroke Program Coordinator Grace Rodriguez. So, Grace, thank you so much for being here this morning with us. How are you?
Good. How are you? Thank you for having me today.
Yes, absolutely. You're welcome back anytime. I'm well. Thanks for asking. So today we are talking about strokes for a reason. Now, first, in the easiest of terms, what's a stroke and how does it really affect a person?
Well, a stroke occurs when a blood supply to a part of your brain is interrupted. This prevents brain tissue from getting oxygen and the nutrients it needs, and in return, brain cells begin to die. They can die in minutes. So with stroke, this is a medical emergency. So the prompt treatment is really crucial. We can't bring those brain cells back. So what we're trying to do is prevent it from getting worse or affecting any other area.
Okay. Thank you for explaining that simply. What are the signs and symptoms we should all be looking out for?
So for McLaren Bay, we use the acronym BFAST. So B is for the balance, sudden loss of balance. I, sudden trouble seeing, in one eye or the other. Face, your facial droop, is your face uneven? Are you drooling on one side or you have a crooked smile? Arms, any weakness on the arms, one of your arms is hanging down. Speech, any slurring of your words. Sometimes it could be aphasia where you have a hard time understanding or expressing what you're trying to say. And then T is for terrible headache and time. So we want to make sure that everybody, anytime they have any of these signs and symptoms, that we're calling 911 and, trying to get here as soon as they can.
Yes, it sounds like a matter of life or death if you don't respond in a fast way. So what are some of the common causes of strokes?
So there are, a lot of risk factors out there, and the common ones that, really, 80% of strokes can be prevented as long as we manage all these risk factors. High blood pressure, high cholesterol, diabetes, AFib, those are the top 4. And so a lot of these things, as long as you're getting yourself checked out, regularly and making sure you're compliant with your medications, making sure that all the numbers are on a normal, levels, then, that's some ways that we can prevent stroke.
Okay, good to know. So for Stroke Awareness Month this month, what is McLaren Bay Region doing to raise awareness?
So we actually have, a lot of things planned out for this month. And, we have to be really creative, with COVID and all.
Yeah.
But we are still holding our heart health stroke screening next week. It is May 12th, Wednesday, from 8 to 12. And that is at the McLaren Bay Region East Medical Mall at the West Center Road, Essexville. And for that, we do want pre-registration, as we want to make sure that we have we're maintaining our distance and we have just enough people in an area. So we want to make sure they're calling the number 1-877-411-2762, and they can give them more information about their screening over the phone. And then also we do have a couple of Facebook Live events with our physicians. Dr. Blaker, our medical director for the emergency department, will be talking about BFAST, calling 911 and making sure that they get the best possible outcomes by coming in as soon as the symptoms start. So that is going to be on May 12th at 5:30 p.m. And then our medical director for stroke program, Dr. Nasrallah, is going to be talking about the risk factors, how to control and treat, and reduce your risk of stroke on May 26th at 5:30 p.m.
All right, so it sounds like you guys have a lot of accessible options for people to join in, which I think is a great thing. Grace, before we go, is there anything that you want us to know about Stroke Awareness Month?
Each year, there's still 50 million strokes that occur worldwide, so 80% of that can be prevented. So what we're really trying to accomplish here by working with the community is making sure they know the signs and symptoms and not to be afraid to come in. We do have a lot of precaution in place in the hospital, so making sure that, as soon as the symptom starts, that they still come in through the ER so we can give them the best possible treatment we could.
Absolutely. Do not delay your care if you really need it. Grace, so good to have you here this morning with us. Thanks again.
Thank you so much.
Absolutely, absolutely. Of course, if you want more information, you can head on over to the Aging in Style page on our website, WNEM.com.